Tennessee surpasses 50 monkeypox cases. Here's what you should know about the virus. Welcome back to Chat Room. I'm with my co-host.
Hey, Michael here.
Okay, so today, according to the Centers for Disease Control, shows that there are 8,934 active monkeypox cases in the United States. As of right now, of August 4th, Tennessee has 52 cases, and 17 of those monkeypox cases are in Davidson County. Does that surprise you that the most ranked cases in Tennessee is in Davidson County, Michael?
Yeah, it's funny, if you'd asked me to do this topic just a couple days ago, I would have had no thoughts because I didn't really know a lot about monkeypox. But I've been kind of listening to some reports, and it seems like it's definitely areas and cities more than like rural areas, which makes sense. Kind of with any virus of any kind, it's going to be where people are more clustered together.
Mm-hmm.
I don't know enough about that part of Tennessee.
Mm-hmm.
I know Davidson County, is it the county for Nashville?
Davidson County does include Nashville, Tennessee.
Then, I guess, Nashville's just a populous place. That area is populous. It's a lot of people. If it were going to be a place, it would be a city.
Right. And I do know, as of right now, Atlanta has like over 150 active cases. And I know a lot of companies, one of them is like Insight Global, I believe AT&T, they both have very big office buildings in both locations downtown. So I would assume, there's at least one or two people that are commuting back and forth, if not hundreds of people. You know what I mean? I think that's just like a small scale of it, just multiple big companies that are in the Nashville area and Atlanta area. Because just in this little small circle, that 4 hours of driving, you've got some of the arguably top 10 cities in America right now. I think there will be those numbers between those two cities will keep going up at a rapid pace.
And I know they're definitely trying to do things to stem it. Monkeypox isn't really new. This is part of an ongoing outbreak that's apparently has kind of gone on the last few years. Just what I've learned, so apologies, I don't necessarily have the source. I was probably listening to NPR. But as they were talking about how it's kind of like in Africa for a little bit, it's popped up in the US before, but this is one that just kind of really especially exploded. And then when it got here, kind of as we do, we're a little slow to respond, but we've had vaccines. We just didn't use them a lot. We've had other kind of safety measures. So it's not as frightening as COVID was, for instance, because it definitely takes closer contact to spread.
Right.
So it's, like you hear 50, just remember when we thought that for, this past pandemic, 50 people would have sounded great.
Yeah.
But for this, something kind of that we weren't expecting, feels like a lot. And it's still something to be mindful for, but it's close proximity. It's not necessarily, breathing in, pathogens or anything like that.
Right, yeah. It says the common known symptoms are like the sores and I guess pus, bumps filled with fluid kind of thing is usually some of the symptoms. Also, it has like you started off with a fever, it moves to headache, muscle aches, exhaustion, might have a rash a few places on your body. So that's a lot of the symptoms of it if the audience is having those symptoms. And it says in this article, how do you contract it? It's mostly spreaded through close contact, also intimate contact with someone that already has the virus. So it's way harder to get than COVID. It's not like you can just breathe it walking past somebody in the mall. So not that you can't get it. I'm not a health official, but it's definitely from the stats and a bunch of health providers, it's not as easy.
Yeah, that's definitely true. And like you said, we're not health professionals, but, CDC, always with anything, talk to your doctor, and that's kind of your best sources for health information.
Alrighty, that's another one in Chat Room. Like, subscribe, stay safe, wash your hands, and we're out.